The contraceptive implant, also known as the birth control implant, is a long-term contraceptive method that prevents pregnancy for up to 3 or 5 years. Now imagine a short, flexible 4 cm rod, more or less the size of a matchstick, inserted into your upper arm. While in your arm, it releases a constant amount of progestin, which is a synthetic form of the hormone progesterone. The implant works primarily by thickening the cervical mucus to prevent sperm from reaching the egg. Some implants can prevent ovulation too. Contraceptive implants are over 99% effective at preventing pregnancy. There are several types available: Jadel, which has 2 rods and is effective for up to 5 years; Nexplanon, which has 1 rod and is effective for up to 3 years; and Leviplant, which has 2 rods and is effective for 3 years. Insertion and removal can only be done by a qualified healthcare provider. Before insertion, you will be asked about your medical history to determine your eligibility. The contraceptive implant insertion is typically not painful, but before the procedure, you will be given a painkiller. A small cut will be made in the skin of your upper arm, and the implant will be inserted with an applicator. After insertion, your healthcare provider will feel for the rod to ensure it is in place. The best time to have the implant inserted is during the first 5 days of your period, as it will be effective immediately. If you have it inserted at any other time during your menstrual cycle, it will become effective after 7 days. A barrier method is recommended during this time since you will not be protected from pregnancy. If your old implant has expired and you want to continue with this method, you can have a new one inserted when you remove the expired one. The contraceptive implant comes with a variety of benefits. It is a widely available, discreet, and easy-to-use method that only requires a single visit to your healthcare provider with no return visits required until removal time. Most women can use this method even if they are breastfeeding or smoke cigarettes. The implant may reduce symptoms of endometriosis and improve premenstrual syndrome. And the best part is that it's reversible. So if you ever decide that it's not a good fit for you or that you want to get pregnant, it can be removed at any time and fertility will resume immediately. The most commonly reported side effect is a change in vaginal bleeding patterns. Some implant users experience heavy bleeding or light spotting, while others do not get their periods at all. Spotting is harmless and should resolve after the first few months, while heavy or prolonged bleeding can be treated. Other side effects may include headaches, nausea, and changes in your sex drive, but these will go away once your body adjusts to the implant. If the side effects are more than you can bear, consult your healthcare provider to establish if this method is suitable for you. And remember, the implant does not protect you from sexually transmitted infections. Learn more about the contraceptive implant and other contraceptive methods by visiting findmymethod.org.